Dear friends, I am Dr. Omi Jiindal. I am the Chief Hair Transplant Surgeon at Darling Downs Hair Transplant Clinic, Toowoomba. Today I'm going to give you an insight about how we hold the consultations for hair transplant patients so that you understand what you are getting into, what to expect on the day, and there are no surprises. We are a medical practice first of all, and we have to follow Medical Board of Australia rules and recommendations, and that's why we do keep 2 standard consults before we take up anyone for any hair transplant procedures, because we want you to get an informed decision made once you prepare yourself for a hair transplant. It's a 2-step process. So in step 1, on day 1 of the consultation, essentially I talk you through different aspects of hair transplant procedure. How is it done? How long does it take? What are the recoveries, after effects, and all those technical aspects I go through, and I use photographs, PowerPoints, diagrams to illustrate some of the technical aspects in a layman's language without medical jargon, so that you understand exactly what this whole procedure is all about. I'm pretty sure some of you might have visited other clinics, but I still would touch base at each and every aspect as a duty of care, so that I make sure you understand what the hair transplant procedure, or essentially FUE, is. Now the second step of the consult is when it is more personalized for you. I take the photographs of your scalp. I discuss with you how would you like your hair design to be, hairline to be, how would you like the density to be, what is the donor side, how good or bad it is, how much scarring is there already or not, is there any medical reason of not to do a hair transplant as well. All those criteria I will discuss with you. Take your photographs, draw some lines, diagrams, demonstrate you what the surgical plan would be for you, and also customize the plan. So once I have discussed your personalized surgical plan with you, I'll discuss all the financial aspect of it, how much it's going to cost to you, is there a payment plan available or not, and how much weekly or fortnightly it's going to cost you. Once we all agree, we agree to the plan, I save in your file, in your folder, so that once we are in your second consult, we take it from where we left and we exactly go after that. The second consult is essentially more of once you are ready to go ahead for a hair transplant. Then again, I first of all answer all your queries which might have arisen after the first consult, clarify them to my best possible capacity, and then we discuss all the financial aspects again. We discuss the time frame, we set a date apart, we book you in, and it's all done. And then on the day when you are here for a hair transplant, you already know what to expect and what not to expect, so that there are no surprises. If you're not able to make it on your second consult, we understand that, but we still recommend doing at least a video teleconsult, so that I can still go through the consent forms, I can still discuss and make sure that you have all understood this process as a whole and making an informed choice to undergo this procedure. Because no decision should be too harsh. Your safety is of paramount importance to me, and being a doctor, that's utmost important. And we at Darling Downs Hair Transplant Clinic vouch for your safety. So we cannot put you in something which is not good for you. And that's why occasionally, not too often, but occasionally, if you are not a suitable candidate for a hair transplant due to any medical reasons or so, we send you back to your GP so that he can take care of your medical condition, get that corrected, treated, so that you get a better experience and a good growth out of your hair. Because we don't want to push you for a surgery. If you don't want it, if you can't have it, rather, you shouldn't be having it. I hope that gives you a good insight about how the consultation process is at Darling Downs Hair Transplant Clinic. But for any other queries, feel free to ask, send us an email, visit in person, because all the consults are free of charge. Thank you so much.